Please welcome Suzanne Koepplinger, who's the director of the Catalyst Initiative at the George Family Foundation.
Good morning. I realize I'm the last thing standing between you and the exit, so I'm going to try and do justice to the rest of your time here with us. But I first want to give a shout out to the Mayo Transport team, the team that put this event together. Didn't they do an awesome job? Could we just give it up for them? To Linda and Jerry and a bunch of people backstage. So the George Family Foundation is a private philanthropic organization based in Minnesota, and we have a long-standing history of investing in integrative health and healing, largely from a systems perspective, also developing leadership, promoting spirituality and community. And you may be familiar with the Penny George Institute for Health and Healing at Abbott Northwestern Hospital in Minneapolis, which is part of the Allina healthcare system. It's one of the most outstanding centers where you can actually access a full array of integrative healing modalities in true partnership with your allopathic clinical providers. In about 2013, they started asking themselves, this is a kind of a top-down approach. How do we build integrative health and healing from the grassroots to the grass tops? And that's when I got involved. They asked me to lead an initiative called Catalyst. We really wanted to figure out, how do we actually keep people out of the system in the first place? Where are the upstream interventions? How do we create self-care as a true primary care modality? How do we help people begin to realize the power that they have to lead lives of wellness in ways other than telling them what they should do? So this is a very ambiguous space that we're living in, right? It's very messy, it's very complex, and the best way we could go about beginning to understand this was to go into community and ask people what they thought this meant to them. So more on that in a minute. But we also developed a set of strategies, and you're looking at them now, and I won't belabor or read the slides to you, but the two that I think are bubbling up, that we're seeing patterns and trends emerge in our work, which started last spring, by the way, are the emergence of grassroots leaders as change agents and finding meaningful entry points to the work. So how do people begin to relate to these messages in a way that has stickiness and will actually help them own the work and continue to practice their own self-care in ways beyond any intervention we can provide? This is a 3-year, $3 million initiative. It's Minnesota specific. It's not a heck of a lot of money in the big scheme of things, but what we're finding is that the buckets of opportunities that we're providing are already showing us a tremendous amount of payback. Why this approach? Why integrative health and healing? I was thrilled to hear the first panel today talk about adverse childhood experiences, trauma, toxic stress. The research is out there. We know that toxic stress, adverse childhood experiences, trauma, all influence our health and well-being. And there's particular research now that shows this, as Dr. Burke was talking earlier, that it's very important to understand how this influences our children. We also are beginning to understand more effectively what works. And there are studies showing now, this particular study was conducted at the Minneapolis Veterans Center, that show that using mindfulness and meditation actually had a better outcome for veterans who are suffering from PTSD. And I'm going back to the question that was asked in the first panel of Sonia about, if we have enhanced awareness of PTSD, why do we still see these high rates of suicide? And I would say it's because the awareness alone is not the factor. It is the intervention that has to be appropriate for that person's healing to take place. And we have not yet standardized and normalized those interventions. In developing this very innovative, organic initiative, we asked ourselves some key questions. How does community define health and well-being? What are the terms that they use? What are the practices that they use? What has cultural resonance for them? And then how do we embed human-centered design thinking into this process, which you heard Natalie talk about earlier, right? It's developing empathy. And that means developing relationships. It cannot be a transactional process of us versus the community, us telling the community what they need. It has to be relational, which means you have to show up. You have to understand your own biases and your own lens that you're coming into the work with. And you have to listen with intention to what people are telling you and begin to respect that people do have a very good bead on what they need. Radical collaboration comes out of that. So we've held a couple of convenings already that have had tremendous response, and I'm going to talk a little bit more about those. But what happens when you bring people together in intentional social engagement is you build mutuality. And when you are in a mutually beneficial relationship with someone, you're willing to invest in them more. You're willing to actually consider their well-being in your actions and in your business models. And rapid prototyping was really a brilliant thing that Bill and Penny George did, where they just said, Suzanne, just try some stuff. We don't have to have all the evidence to show that this will work. We want to learn with our community partners. Let's just get going. And I think that's a very different model for philanthropy, because most philanthropists will study the thing to death. They'll analyze, they'll read the research, they'll hold focus groups, and then they'll come out with the thing they think will work and tell community, here's what we want you to do. We'll fund this thing. What we're doing is antithetical to that. We're asking the community to tell us, what do you think will work? We're also using our research. We're also being strategic in how we're investing. But this is a very different model of investing in community. So we have 3 buckets of investment. We're providing training and skill building. That's that grassroots change agent piece. How do we develop the change agents in community? We're hosting convenings to ignite new energy, to build smart networks of people who are reinforcing their own behaviors within a culturally specific context, and we're providing small seed grants. I just want to talk a little bit about one of these seed grants, the Minnesota Indian Women's Resource Center, where I spent 10 years of my life as the executive director. In the Indian community, health disparities are extraordinarily high. Social and economic disparities are high. There are very high rates of obesity, diabetes, heart disease, cancer, high rates of suicide, mental illness, substance abuse. What we begin to understand is in communities that experience historic trauma, multi-generational transmission of trauma, these indicators are all common. There's a similar set of patterns in the African American community, in many of our immigrant communities. So we really wanted to understand, how do we help people heal from trauma in a culturally respectful way? And in 2009, we did the first research in the country to analyze the scope of sex trafficking of any demographic group, and that was a report called Shattered Hearts that looked at sex trafficking of American Indian women and children in Minnesota. We opened the floodgates because all of a sudden people were coming into the agency with horror stories of being sold into prostitution at the age of 7 by a parent or by mom's boyfriend. And I watched my staff at that time, who mostly Native women with their own trauma histories, brilliant, fierce, courageous women, get triggered in ways I had not seen before. So vicarious trauma starts to show up, secondary trauma, which many of the helping professions experience but don't recognize or talk about or validate. So we met a guy named Dr. Jim Gordon from the Center for Mind-Body Medicine in Washington, D.C. And 2 elders from the Indian Women's Resource Center and I went to his training in San Francisco 2 years ago. And after the first day of that training, those elders said to me, this is what Indian people need to heal from historic trauma. We want to become trainers. I always do what my elders tell me to do. And so today, those 2 women are the only Native people in the United States who are certified from the Center in Mind-Body Medicine in Washington, D.C. as trainers in this model. And why this works is because of who they are. They are the respected elders in community. People listen to them. People go to them for advice, for counsel. And when the respected community change agents shift the dialogue, when they shift the practices, it has resonance, it has stickiness. And so we're seeing that same pattern emerge with all of our partners here. And the common theme that's running through these communities, where health disparities are high, where trauma rates are particularly high, is, oh, here's our elders. I love these ladies. Is the factor of trauma as a deterrent to a healthy lifestyle. So I said earlier we were asking community how they define health and well-being, and when we talked to people and said, what does it mean to you when I talk about integrative health and healing, or mind-body medicine, or what does it mean to you to practice self-care? And many people would say, it means nothing to me. I got these 3 kids that are giving me trouble. I'm going to lose my housing. That man keeps hitting me when he comes home. I don't have time for that. I can't experience self-care. I'm having a hard time keeping body and soul together. So it didn't resonate. So we asked this question, what would it mean to open a conversation around using whole person practices to heal from trauma? We had no idea whether people wanted to engage in that conversation or not. So we hosted a convening in March of 2015, and we were astonished at the response. We had 250 people show up. We had turned 100 people away. We didn't know that there was that much energy and that much desire to engage in that conversation. So we had a second convening in August. Totally over 500 people have come into this space to tell us we are hungry for these safe spaces to identify how trauma is holding us back from being healthy, from practicing healthy lifestyles. So the big takeaway here was the importance of culturally resonant healing practices, because those have receptivity, and those practices are actually what people will access when they can. At this convening in August, we asked a couple of questions just because we're trying to get some outcomes. We want to understand how people are experiencing this. And almost half of them said, yes, they're willing to participate in this conversation again, come to another convening, which to us indicates there is receptivity to linking integrative practices to healing from trauma. We also had half of the people say, we're going to tell somebody we know about this. That, again, builds smart networks. That's about mutuality. That's about creating connectivity in community. And then almost 80% of people in the room said they met someone across race, class, or culture that they intended to stay connected with or work in partnership with. This is a very important outcome because building partnerships and building mutuality across race, class, and culture, getting out of our silos, is a vital component to healing and being well in community. So in the nature of letting the community voice take precedence, I'm going to show you a quick video which actually shows you some of the events that we've sponsored and how people are responding to them.
There's so many different types of meditation. It's just really around what you are focusing your awareness on.
The Anishinaabe model of wellness is mind, body, spirit.
You can close your eyes if you wish. We're just going to do our first exercise, the soft belly breathing exercise. And I can say, I believe it's the foundation of the work.
Being able to take care of your mind and body in a way where you can self-regulate through some things makes you more mindful in everything. It makes you more mindful about yourself, nature, your other people.
And becoming centered and focused and knowing that you're in a safe spot, it's a very incredible feeling.
Remembering the importance of breathing, which is so simple and so silly, but just doing those slow breaths and what that source of energy can bring you.
So we're going to come up, bring our arms up, okay, and then we're going to just bring it down as we exhale.
What do you think of the moves?
I loved it. Yeah, I love the integration of the sound and the breath and the movement. That ability to bring mind, body, spirit together in something really simple.
Hopefully these are things that you'll be able to use wherever you are.
Trauma lives in your body, in your mind, in your spirit, and so the healing has to come in your body, in your mind, and in your spirit.
I do psychotherapy and I incorporate this spiritual healing work into it when I can.
You did not choose the language, ni fronteras, or borders.
There's a way that they move through things in a very different way than the people who just do talk therapy.
We are wanting to promote is traditional healing, which is very, very important for many people.
So we need to trust the cultures, know where their healing comes from. It's a holistic approach for mind, body, and spirit. It's about learning from each other, not separating cultures and separating medicine.
We are slowly working our way toward creating an environment of wellness.
Say we need to trust that cultures know where their healing comes from. I don't think we do a very good job of doing that yet, but we're beginning. So typically, what happens when we begin to understand trauma is that we have trauma-informed care lens, right? Well, is that a trauma-informed practice? This is a very important construct for us to begin to understand, and most of the funders are going there, Is that trauma-informed? We might fund that. If it's not, we won't. But what it means is we have different language to talk about trauma. We have different understanding about how behaviors are showing up, but it hasn't fundamentally transformed our practice of responding to the trauma. So what we tend to do is screen for trauma, as Dr. Burke was talking about this morning, screening for ACEs. A lot of people are not doing it in the proper way like she is. A lot of people are asking young people to explain, so what happened to you? Were you abused as a child? So they're asking these questions without really understanding what they may be opening up. So we screen for trauma and then route them into a clinical intervention, which may be the exact right thing to do. But let me pose some barriers that are showing up. There's probably a wait list, depending on where you are, particularly in rural America. Do you have the right insurance to get into that therapist? Does that therapist understand your culture? If you are a Somali woman, you cannot see a male therapist. And does that therapist understand what happened to you in the refugee camp? There's a whole question around transportation and childcare, but a bigger barrier is the fact that for many people in community, they see this as a path to being pathologized and medicated, which they may not choose to do. So they're not going to show up. So what we're suggesting is that having access to healing in community, this term trauma healing practices is really that thing that works for people. It could be Tai Chi, it could be meditation, mindfulness. It could be other healing practices that are grounded in spirit, cultural ceremony, it could be body work. It's not for me to say, it's for the person who's experiencing the healing to tell us. And so what we're trying to uncover is where in the context of our communities are these healers, and how do we help promote that as the social norm? And how do we make sure that that clinical intervention is part of that continuum of care, so that the clinician is also either grounded in or has a deep understanding of community and these healing practices. So if a Native person says, I need a ceremony, that isn't seen as something outside of the spectrum of a care plan. So I just ask you to think about how this looks in your work, and understand that even though Catalyst is a new, organic, untried initiative, we still have to figure out if it works. And we looked at this from the basis of a traditional formative evaluation process and said, no, this is really not something that we can assign metrics to. This is messy human dynamics with lots of variables. It's big social change stuff. So we landed on a developmental evaluation model that I think is very exciting. It really asks 3 questions. What? So what? Now what? And in context of this trauma conversation, we understand the what is clearly trauma plays a significant role in our health and well-being. So what? What does that mean? What are the implications? What should we do about that? It means that mind, body, spirit, and cultural healing practices are effective and desirable in promoting individual and community healing. This is what we're learning. And the now what is, we now need to understand the power of holding safe space so that people can come together, grow their capacity to heal through practice, connection, and affirmation. We'll have our first major report on the Catalyst Initiative coming out in early 2016, and the lessons we learn along the way will be incorporated into our next action steps. It's very exciting work. I encourage you to take a look at our website. You can contact me with other questions. I'm aware of the time, and so I thank you very much for your kind attention.
Thank you, Barbara. That's great. Great. Thanks so much. We're
all
running
done.
out of time
We're
here,
all
so
done.
you're all done.
All right.
Yes. No interrogation for Barbara. And with that in mind, let's look back on the last couple of days as you think about saying goodbye.